All right, well, I'll just kind of have a slow introduction. It's 4 o'clock, so thank you, everyone. Welcome to our webinar. My name is Karen Pierce, and I'm the co-director of the UCSD Autism Center of Excellence and a professor in the Department of Neurosciences. And I'm very excited to be co-hosting this with Shirley Fett, who you probably all know, who is a former president of the Autism Society San Diego. And she's a nurse practitioner and a family mental health specialist. And so she has a lot of great details to share. Today, she's going to be talking, I'll let her explain what she'll be talking about. So how this is going to work is the first 15 or 20 minutes, I will describe just a couple of studies from UCSD that I think might benefit your families or that you might be interested in learning about. And then Shirley will kind of be the closer and take the last 10 to 12 minutes. And along the way, if you've got some questions, just go ahead and put it in. Looks like people are using the chat, which is fine. You can put your questions in the chat. And then Palani Tishering here, who you can see on your screen, she is a coordinator for our projects here at UCSD. She'll be going through the questions, and at the end of the webinar, she will be calling out some questions, and Shirley and I can provide you with some answers, but we'll probably do it at the end since it's a pretty short webinar. So we're now up to 70 people. So I think that sounds like a respectable number. So we'll go ahead and get started here. So our mission at UCSD, at our Autism Center of Excellence, is really to understand each child's unique clinical and biological profile so that every child can reach their full potential. Right now, you guys know that treatments for children on the spectrum work to varying degrees. Some children make big advances and some children don't. And it's never really clear why some children may be doing better than others. And that's because we've been doing, treatment the same way for all kids pretty much similarly for the past couple of decades. And, we really want to move into the era of precision medicine where we really understand children more before we start deciding which treatments might be best. And so we do a lot of things at our center. We do early screening and diagnosis. We do genetics research, brain imaging, stem cell research, and eye tracking research. We have over 20 scientists working together here in our lab in La Jolla. We try to publish our findings in a timely manner so that the public can read about it. We have a new paper in JAMA Pediatrics and Nature Human Behavior and Journal of Pediatrics. So we don't just do research, we also then try to disseminate it to the public so that everybody gets to share in the results and the findings. And today I'm going to really just talk with you about two of our ongoing studies. One is a SPARK study, and one is what we call the school age outcome study. And the SPARK study, you may have heard of SPARK, you may not have. It's actually a study that's funded by the Simons Foundation, and SPARK stands for Simons, Powering Autism Research for Knowledge. And I'm going to have just 2 slides after this, talking a little bit about genetics, bringing you back to your biology days. And these are going to be the only technical slides, because this SPARK study is really about discovering genes that are different or unique in children with autism relative to people who don't have autism. Again, with the idea that one day we can maybe use this knowledge to develop better and more effective treatments. And so it's a saliva-based study. You basically spit in a tube, and then your saliva gets examined and analyzed to see what the unique profiles are in kids with autism as well as their parents. So just to make this all make sense, just remember back genetics 101, every cell in your body has all of the genes in the human genome. So there's around 22,000 genes, and your genes are located on your chromosomes. So every cell has these. And the way the kind of a gene is read is kind of based on these little molecules called nucleotides. So every gene is made up of a different sequence of nucleotides. So we have adenine, thymine, guanine, cytosine, so A, T, G, C. And let's say hair color is A, T, C, G, A, everything about us has a gene that codes for protein that gives instructions about certain things. And so what happens sometimes in kids with autism is there could be a single change in a single letter in a gene, and that has like a big impact on the child's development. So this is an example of a sequence of a particular gene. You've got your 3 little nucleotide letters going along. There's around 3,000 of these letters in an average gene. And let's just say something got changed, that A got changed to a C. That really makes a huge difference in how that gene functions. So if you think about just a sentence in the English language, Bob the cat cannot sit. What if we changed the C? What if we change it to a B? There's just one letter change And the sentence is completely different. Bob the bat cannot sit. It's completely different than the original sentence. And that's kind of like how it is with genetics. So when something is special going on with your child, if they have a gene issue, it could be as simple as one nucleotide out of thousands and thousands. And that's what can be causing issues, maybe with language or with social or with other things, sleep. So the Simons Foundation has this study where we're going to be trying to get 50,000 families, and we're already up to over about 45, just provide a saliva sample, and then we go ahead and send that out for DNA analysis. So the Spark study, we're recruiting 50,000. We return genetic results. So once your saliva sample, and we try to get saliva from mom, dad, and child, although we can do it just from mom and child. Once you ship that off in the mail to us and then the Simons Foundation, we return genetic results. Around 10 to 15% of children are getting a result. And we also then will invite you to any further studies that maybe matches your child's genetic profile if you'd like to participate. So again, this is all with the idea of trying to move towards precision medicine. Right now, this particular Spark study has 31 research centers across the United States, and UC San Diego, my lab here, is one of them. And we've gotten saliva samples from over 44,000 individuals with ASD and 120,000 family members. So we've been really successful, but we're trying to push for more. And again, returning genetic results, 10% or more of families. And these analyses have increased our understanding of the number of genes that are associated with autism. And then what's great about the Simons Foundation is they publish this gene list, so everybody in the world can kind of just go to a reputable place to understand the genes that are associated with autism. So here's the Spark gene list. When the study first started, there were only 78 genes associated with autism in 2017. Now in 2021, when this list was last updated, there's 167 genes. So it's gone up a lot, and these are publicly available. And you can just go to that website to get some more updates on the Spark gene list. And there's also different databases that tell you, let's say you wanted to understand AC, TB, what does that gene do? You just go to this database down here and it will tell you what that gene actually does. So it's a great resource. It's a really wonderful project, and it's super easy. You just spit in a tube. If you've ever done 23andMe, you spit into a funnel, you twist off the funnel lid, and you screw on the cap, and you're done. So it's a really simple way. And if your child isn't able to spit, you can just do the assisted saliva collection. Just take a Q-tip, swab it into your child's mouth. It gets kind of wet, and then you dab it on the side of the tube to let the liquid pour in. And then you just pop it in the mail. And we return results within, it's actually now about 6 months, 6 to 12 months. So it does take a long time. That's the only drawback. But you will get, if there are any results to be had, you will get results. Also, you get free review from a genetic counselor if you would like some more information about what these genetic findings mean. It's all paid for by Sparks. You don't have to do anything. And here's kind of an example of what the report looks like that you would get. They'll first contact you by email, and then they will also give you like brochures and information about the particular genetic issue your child is having. And it's nice because sometimes some of the genes are related to medical issues. And you kind of would like to know about it, like increased risk for certain cancers or heart issues. And so it's kind of nice to know about these genes because there could be some medical things that you want to kind of follow up on with your child. So it's really easy to participate. You just sign up online. We have a website, sparkforautism.org/UCSD, and it says .SARC because that's one of our partners. And Pilati, our coordinator, is going to contact people after the webinar and give you this link if you'd like to sign up, so you don't have to worry about copying it down here. So when you sign up online, you're going to be filling out some consent forms to participate in research and DNA analyses. Then you provide a saliva sample. Then we do DNA sequencing. And the cool thing about this study is that every year, because they're finding new genes related to autism every year, your saliva will be resequenced. So let's say you participate in 2022, but you didn't get any results. Maybe in 2024, someone will contact you and say, surprise, we have results, because they reanalyzed your saliva. So you kind of get these new updates every year. And then there's other opportunities. Everything is always just passive by email. So you never have to sign up for anything you don't want to, but people may email you saying, hey, do you want to sign up for another study? And then you could just say, yes, I'd love to, or you can ignore it. So, and this is really for families with a child of any age. So you could have a child that's, 40, and you could be 65 and still be eligible. There's lots of benefits. You'll get a $50 Amazon gift card, access to monthly webinars and newsletters. Once you join this Spark study, you're kind of part of the Simons Foundation family, and they're always putting on lots of great webinars, kind of like Shirley's on sleep, they have things on sleep, anxiety treatment, up-to-date research findings. And so those are kind of fun to have access to. You can participate in other studies. Obviously, nothing's ever given, your information is never given out without consent. You get knowledge of genetic results, potentially for 10% of families. And then also you get the free genetic counseling if something is found. And also you join the community, right? It feels good to help. It feels good to be part of something. And so that's why I really like this study. And contribute to a historical autism research project. No one has ever tried to get 50,000 people in one study. So this is a big deal. And there's lots of easy ways to do it. If you're a parent, schedule a Zoom. Palani can walk you through it, or just sign up yourself on the couch with the website link that we're going to send you again. Or we can even just come by your house. We can come into your home or just do a driveway visit and help you get the saliva. So it's lots of easy ways. If you are a medical provider, we can do a tutorial for your team. So you can let the word out to your families that are in your practice, or we can just give you some brochures for your waiting room, or brochures that you might want to directly give out during visits, however you feel like you'd like to do it. And if you're ready to sign up for Spark, this is the QR code, which we'll also send you, but you can scan it now. And that gets you directly to the page to enroll in Spark. And then the only other study I wanted to talk with you about that I think also has a lot of value, is really interesting, is our school age outcome study. This is where we're trying to understand kind of the course of like the early development period for kids. And we have a couple of questions like, how do children with autism change from toddler age to school age? What percentage of children with ASD are completely mainstream and have skills within typical levels? And are children, when they get to school, how many kids are super happy? What percentage of kids feel anxiety? And so basically this particular project, you come to our center in La Jolla, and it's actually pretty of an intensive testing that goes across 2 days. You get a written report by a licensed clinical psychologist of all these different standardized tests that your child participates in. And your child or you receives $100 for participating, as well as I said, a written report by a licensed psychologist. That's great for your IEP, great potentially for treatment planning, so you can see what your child's strengths and weaknesses are. And we also ask parents to fill out some forms because we want to know how the parent feels about how happy their child is, or how anxious their child is, or kind of what children of this age are feeling. And so we have parents fill out some questionnaires as well. And so those are 2 fun and exciting studies that I think might be great for some people to join us in. I'd love to see you in the lab or on the Spark portal. And with that, I am going to turn everything over to Shirley for her part of the presentation. Oh, and this is a QR code, sorry, for the outcome study, if you'd like to participate in that one. Again, we're going to send information post webinar, but this is our lovely coordinator for that study at Siri, and you can sign the QR code for that one. All right, so thank you so much, everybody. I really appreciate your attention here, and I'll turn it over to Shirley.
Okay, that was great. Thank you, Dr. Pierce. Let me pull up my slides and start to share those. So that was terrific. And I just want to add to Dr. Pierce's information that we as a family are part of Spark, and we've been very happy to be members of that. I think we were part of the first year it rolled out. So as you said, they send out really great information. There's lots of great webinars and so on. So I do encourage people to really consider it. It's not difficult, it's not intrusive, and it's a really great thing, I think, to do. So thank you for that. I've been asked today to speak to all of you about autism and sleep. So real quick, just a little bit about me. My name is Shirley Fett. Professionally, I am a family nurse practitioner, and I'm a pediatric mental health specialist. I work professionally for Smart Care Behavioral Health here in San Diego County. It is a county-funded program to provide consultation to physicians, primary care providers, and families. I think I was primarily hired because of my background in autism for this program, so I'm really delighted to be a part of that. I'm also a long-term board member, volunteer with the Autism Society San Diego, and I'm very dedicated to autism community here. My most important job is that I am the mother of 2 adult sons with autism spectrum disorder. My son Brock on your left side of your screen, he's going to be 31 on Sunday, and then my other son Derek is on the right, and he's 29. And you can see photos of us having fun times at the beach and at camp with both of them. They still live with us. In today's language, they would be considered level 3 autism with intellectual delay and speech impairment. So they have high support needs, and we love them to pieces. And I'm happy to say I'm going to Disneyland with my 31-year-old. 1-year-old on Monday because he'd like to go there for his birthday. So I'm excited about that and being able to celebrate that day with him. Today is a quick version, just like Dr. Pierce. I'm going to go pretty quickly on the topic at hand. For those of you who are interested, on the Autism Society San Diego YouTube channel, there is an hour-long version of this lecture that goes into more detail, a little bit more elaboration on some of the things I'm going to touch on today. They are free, easily accessed. In addition to autism and sleep, there's a multitude of other topics. For example, there's some on aggression, accessing services in San Diego. There's a lecture on medications and autism. So there's quite a nice variety. And again, they're free, so at your leisure. If you're interested, you certainly can go to that site and watch those. But Autism and Sleep in the full version is there as well. So it's not going to be a surprise to those of you who are autistic, have autistic family members, or work with the autistic population that sleep is a very challenging behavior. When I prepared this lecture, there actually has been very little research in this area. So I'd love to tell you there's lots of data and clearer understanding of why this is happening. It is poorly understood, and sleep disturbances are often seen as less urgent than some of the other challenges being faced. So what does that mean? When our children are little, we're more worried about their elopement issues, or maybe their aggression or their eating issues. And so sleep tends to fall down on the hierarchy of things that we focus on because there seem to be more pressing issues. But I will tell you, as the years wear on, sleep becomes higher on that list and becomes more problematic. So I encourage all of you to really incorporate addressing sleep issues in your overall therapeutic regimen as early as you can to try and really support the individual and get them regulated as best we can. A lack of a good night's sleep can affect not only the child or the adult with autism, but it does affect the entire family unit. And I think that's important for us as well. Exhausted parents don't deal well. Exhausted siblings don't deal well. So it's really a family dynamic for everyone if we have a dysregulated sleeper in the household. So how common are sleep problems in autism? So there is a little bit of research that suggests that over 80% of children and adults with ASD experience sleep problems, which includes difficulty falling asleep and staying asleep at night. So it is very prevalent, more so than in the general population. So insomnia in adults, I was kind of interested. I have adult children myself, as you know, so I was interested to see what they knew about adults with autism. There was one study I found done in the Netherlands in 2019, and they focused on adults and addressing insomnia. And what did they find? That sleep problems in autism are not limited to childhood, but often persist throughout the lifetime. The severity of this insomnia was predicted by overall sensory responsivity, as well as the social skill level of the participant. So the last statement more clearly states, if the individual had higher sensory reactivity, was more neurologically sensitive, both visual, auditory, tactile, and also those individuals that tended to have lower social skills, they tended to also have more severe insomnia. So how does autism actually affect sleep? And again, I'd love to tell you there's a lot of research on this. There's some theories, and it is the sensory differences that we all know are part of being an autistic person. Is it increased sensitivity to light, sound, touch, those kinds of things? So is it just the overall sensory experience is so heightened that it makes it difficult to sleep? Possibly. There is some theory that melatonin, which is a naturally occurring hormone in our bodies, it helps all of us with our circadian rhythm, our awake sleep cycles. The production of this hormone in autistic individuals is being theorized that it may be produced irregularly or at lower levels, which therefore makes it more difficult for a person to naturally sleep. Again, that atypical circadian rhythm or body clock is part of autism in many people. A lot of autistic people have poor sleep hygiene. For those of you who don't know what sleep hygiene is, we're going to talk a little bit more about what's good hygiene and what's bad hygiene. And this might be one of the areas where we actually can have some impact and intervention to help individuals sleep better. And then we have to think about, are there co-occurring conditions that are contributing to sleep? Is it just the autism, or is the person also experiencing other co-occurring mental health issues like severe anxiety, which could also contribute to poor sleep? I also will add in here, I'm seeing more and more autistic individuals that have had some trauma. And so there could be some PTSD as well in their lives. So I think mental health can be a variable here as well that should be addressed. So what are some possible medical reasons for sleep dysregulation? Many individuals with autism have gastrointestinal GI issues. Are they constipated? Are they having a lot of gas? Are they having reflux or heartburn? And so when you think about people with lower language abilities, they can't tell you, my stomach hurts, I've got gas when I lay down, I have acid coming up into my throat. We do have to be a bit of a detective to help sort out what's going on with this person. And I don't think we should rule out medical causes as a first tier. There could be side effects to medication. You know, we take medications or do things and we say, oh, I'm not taking that again. It makes my stomach queasy, or wow, that gives me a headache. I can't take that again. Again, think about an autistic person. Again, individuals who may be less verbal, they might not be able to articulate that. And so the manifestation could be restlessness and can't lay down and go to sleep. Seizures, individuals who are not sleeping well at night, we always want to rule out seizures. Individuals with autism spectrum disorder do have higher risk of seizure disorders, so I think it's important to consider that. Sleep apnea is a phenomenon where an individual snores or breathes heavily, and then they'll have periods where they actually stop breathing. This tends to co-occur in individuals who tend to be overweight or obese. So I think it's important to be mindful if a person is overweight or obese, looking at their sleep behaviors. Are they having periods when they're sleeping where they stop breathing? 30, 40 seconds, and then they start snorting and breathing again. That could be a sign of sleep apnea. It needs to be treated. And is this person in pain? You know, do they have a big old blister on their foot, or do they, you know, do they have back pain because they were working all day at their day job and they strained their back and they can't really tell you? So I think there are medical reasons that we need to think about when trying to figure out the sleep dysregulation. So we talked about sleep hygiene and things that make us less likely to sleep. This is true for non-autistic people as well. So bear this in mind. If the shoe fits, put it on. So here we go. In adults, using alcohol or sleeping pills to sleep has been clearly shown to dysregulate sleep long-term. It might work in the short term, but it is not good for long-term sleep maintenance. Drinking excessive caffeine during the day, and this can be applicable to children as well, particularly kids that are drinking a lot of Coke, Pepsi, caffeinated beverages. So be mindful of that. An irregular sleep schedule, again, napping, sleeping 2 hours, waking up, you know, not going to bed till 1 in the morning and then sleeping till 11 in the morning, these kinds of things, an irregular sleep schedule. Napping is a huge culprit for nighttime sleep. It sabotages nighttime sleep if you're coming home from work or activities, or the child's coming home and is taking a nap, and then all of a sudden it's like, why don't they want to go to sleep at 9 o'clock at night? Well, they slept for 2 hours, you know, from 3 to 5 o'clock, so they're not tired. Eating a lot of sugary foods or large heavy meals before bedtime also can be a culprit for preventing someone from falling asleep. And also not being active enough or getting enough activity or exercise during the day can be problematic. Some kids need to burn off a lot of energy. So do some adults. They need to burn off a lot of energy. I have my sons pretty active all throughout the day, which I do think naturally helps contribute to their sleep. And also if you exercise too close to bedtime, you know, it's the old adage, where parents were told, don't get the kids wound up right before bedtime. It's kind of true. You don't want to get them wound up before bedtime with too much physical activity or too much stimulating activity. So common sleep issues, I'm sure most of you on this webinar today could read these off and tell me what these are without this slide. But in summary, difficulty with falling asleep, so onset of sleep, difficulty with sleep maintenance, which is staying asleep through the night. Also, a sleep issue could be waking up early in the morning. I just did a consult with a mom the other day whose child wakes up every day at 3 a.m. So that's not good. Short duration sleeping, only sleeping for 2 or 3 hours and then waking up. Sleep fragmentation, as I mentioned earlier, has an erratic sleep pattern, sleeps for 2 hours, wakes up, this kind of thing. And another common sleep issue is just hyperarousal or anxiety around bedtime. You know, it's sorting out, why is this child or this person getting so anxious around the context of going to bed, and trying to identify how to make that less of an anxiety provoking experience. And then excessive daytime sleepiness, which makes an individual prone to napping. There is some data that shows poor sleep can worsen challenging behavior. And let's just be honest with each other. If we don't sleep well, we're kind of crabby too, right? So, I mean, you know, we'll cut some slack for the autistic individual, but the manifestation of poor sleep for them may look different than you and I, where we can kind of say, I didn't sleep well last night. I need to just chill out and go, you know, do my own thing. They might not have the luxury or the ability to do that. So what you might see in a person with autism who has sleep difficulties is hyperactivity. They might become more compulsive. They might become more physically aggressive. They might be more ritualistic. Some of you like to refer to it as OCT, but just kind of, fixated on doing things a certain way, that rigidity we see, less intention. There was a study that said individuals with autism who do have significant ongoing sleep problems, it is a strong predictor of a need for psychiatric hospitalization later in life. So going back to what I said at the beginning, let's really work on sleep behaviors as soon as we can and as soon as it's noted, because I think we really need to look at overall health, and it was a strong predictor for future possible psychiatric hospitalizations, individuals who don't sleep well. So what can you do? So as I said earlier, you need to be a detective, and that's involved keeping a log. How things to look at and think about when you're logging the person's behavior is, how long is it taking from the time where you start the bedtime process and going to bed to actually falling asleep? Keep data on that. I think it's enlightening. Dr. Pierce is a researcher too. I mean, you've got to keep data to really factually, what we think is going on may not really be the cause. So how long does it take them to fall asleep? The number, the time, and the length of nighttime awakening. So if this is a kid or an adult that's waking up 2, 3, 4 times a night, what time did it happen? How long were they up? Again, note that information. What time are they waking up in the morning? And what was their total sleep time? Cumulatively, they slept 20 minutes here, 30 minutes here. Do a total amount and see how much time are they sleeping. And I think it's important to also assess, are they napping during the day at school, at their program, or on the bus? This used to drive me wild when my kids were in school. They'd say, oh, we let them take a nap for 2 hours. And I'd be like, come live in my house. It's not, and this is really common for kids that have long bus rides that maybe will ride the bus for an hour to and from school. They many, many times will sleep on the bus. And so again, this is part of your assessment, and then problem solving. How do we address this? Because it's napping and it's sabotaging nighttime sleep. Where's the location of the bed? Is it in your bed? Are they sleeping in the living room? Are they sleeping on the bus, as I mentioned? So where is sleep occurring? And then what is the bedtime routine? And if you don't have one, you need one. And then note any situations that predict when the problem behaviors will occur. This could be, on Saturdays and Sundays, they sleep great. Maybe they're anxious about going to school during the week or going to their day program during the week. And maybe they get anxious and they can't sleep during the week because of that. So again, trying to be the detective and sort this out is really helpful. How can good sleep habits be developed? So what are some interventions? Set a consistent sleep and wake time. This will strengthen the circadian rhythm, that awake sleep cycle. Make sure the room is dark and quiet. A very low wattage night light is okay at floor level, and it can be used if necessary. Try and keep environmental noise to a minimum. Ensure the bedroom temperature is at a comfortable level. Higher temperature rooms disturb sleep. It's better to be cool when you're asleep, not hot. Ensure that the child or the person is not hungry going to bed. This is something that kind of bothers me when people say, oh, they ate dinner and they can't have any snacks after dinner. My sons like to snack before bedtime. I think they have a high metabolic rate, and I think they would be dysregulated if they went to bed hungry. So think about that. Avoid drinks with sugar additives, as mentioned earlier, or caffeine before bedtime. Warm milk is a suitable alternative, and limit the amount of liquids. Are they waking up at night because they have to go to the bathroom? That's an option. That's a possibility as well. They're drinking a lot of liquids, so they have to use the bathroom. More good habits, only quiet, non-stimulating activities in the hour before bedtime. No screens, preferably no television, tablets, monitors, or phones. This is true for all of us, by the way. This is what we're supposed to do to help ourselves sleep. Those lights from the monitors of our electronic devices send a message to the brain that says, wake up and pay attention to me. So try to avoid those. The bedroom should be free of electronic equipment. Avoid naps, as mentioned earlier, and help the person learn to fall asleep on their own in their own bed. This is a common problem. Oh, well, they'll fall asleep as long as they're in my bedroom, in my room. So, working towards getting them happy, safe, and comfortable in their own space. You may consider some occupational therapy interventions, such as a weighted blanket or other sensory calming support. We used a white noise machine for a while with my son, just to, ocean waves kind of thing. That was helpful, that white noise thing. Can sleep and its benefits to overall well-being be taught? And the answer is yes. As I mentioned, it needs to be individualized to the child or adult at their cognitive level, and this may involve using visual support, social stories, specific teachings on the benefits of sleep, or a CBT. And they actually have cognitive behavioral therapy for insomnia. For those of you that don't know it, there's therapists that specialize in this. So that could be a possibility. I'm just real quickly showing you the classic board maker schedule. That is a great schedule. I use these for years with my sons for their bedtime routine. You know, something very similar, visual schedule, so they know what's next and what's expected. Consistency, consistency, consistency here. So social stories can be also very helpful for children that unlike those, and you can do a social story. Social stories should be positive, not negative. And you know, there's all kinds of really great information on the internet about social stories. If you're not familiar with them, Carol Gray is the founder of the social stories curriculum. She's got a website, but you know, you write a social story and then you read it, you know, during the day, or maybe an hour or two before bedtime. And it's sort of this narrative about going to sleep, and sleep is a good thing, and empowering the person that they can go to sleep on their own. So this is an example of a social story. Is there a connection between anxiety, mental health, and poor sleep for those with autism? And the answer is yes, and it's bidirectional. What does bidirectional mean? It means that the presence of anxiety or other mental health disorders like depression, bipolarity can worsen sleep. And poor sleep can also cause a person to feel anxious and depressed. So that's what bidirectionality means. It can go both ways. Anxiety is often associated with psychologically hyperarousal, which basically means anxiety is associated with being elevated, stimulated, overstimulated, overly sensitive, and it can make falling asleep difficult and increase insomnia. Mood disorders such as depression are also associated with overactive brain activity and hyperarousal, and can negatively impact sleep. So it is important, as I said earlier, is it autism and something else contributing to the insomnia? And if it is, having a professional assess that and treat the underlying mental health issue as well can benefit sleep. I'm not going to talk today a lot about medications. This is elaborated on in that lecture that I mentioned to you before, but certainly sleep is important, and there are medication options for individuals that we cannot successfully get sleeping well through some of these other non-medicine interventions, and they do exist. So that would be something to consult a professional to talk about. Is this appropriate for the individual? And then there's anxiety management strategies to help improve sleep, very similar to sleep hygiene we talked about before, listening to calming music, decrease stimulating activities. There are some relaxation techniques. You know, it's interesting, you know, Calm has some really interesting apps for deep breathing. Even my sons with autism were able to start doing those a little bit during the COVID time. We started doing some of those things. So never underestimate the value of those kinds of things. And there's a lot of really great techniques and things on the internet for calming. Like I said, there's the Calm app and other things. And if the child is verbal or the adult's verbal, encourage them to talk about their anxieties and their worries, giving them a forum to talk about what they're concerned about or what they're afraid of. These are some resources, some books, Sleep Better, a guide to improving sleep for children with special needs. So again, that's specific to our population. Solving sleep problems in children with autism spectrum disorders. There you go. Somebody's written a whole book on it. So you know it's a big problem for families. What to do when you dread your bed. That's more of a general resource for sleep. Autism Speaks has a free resource, quick tips improving sleep for children with autism, and a really great social story called Sleeping in My Own Bed that I thought was really useful as well. So those are some good resources to look into. It's not an impossible dream. Manage any medical problems, follow basic, consistently applied changes to the routine to include increasing physical activity during the day and less stimulation at night. I want to thank you all for joining me today. And I know I went through that really fast. I think we've got a couple minutes perhaps for questions. So I'm going to turn it back over to Palani and Dr. Pierce. And again, thanks for joining. And this is how to get a hold of me if you need to reach me directly.
Yeah, so I think somebody asked in the questions for your contact information. So if you want to get it down right now for Shirley, but we can, like Dr. Pierce said, we'll reach back out to you because we have your contact information if you have more specific questions if we don't get to it right now. But for Dr. Pierce, somebody asked, what if we only have dad and child and not mom and child?
That's great. We would love it. So dad and child is great. As long as we have at least two people, then it's perfect, because we're looking for things that might be specially unique in the child. And then if we see that, we're like, hey, let me check mom and dad, or just one of the other. And so we need at least one parent, and that one is good. So yeah, dad and child is fine.
Right, for the Spark study.
Yeah, for the Spark study.
And then somebody asked, can adoptive families participate in Spark?
That is a really good question. Yes, we do also look at just the proband, but obviously because there's no genetic relationship between the adoptive parents and the child, the adoptive parents would not be providing a saliva sample for the study because we would have no way to connect it up, but your child could participate. So we do have some examples of individuals on the spectrum who just really want to participate, and we do, we do welcome that as well. But really when you get both parents and child, that's when we get the most amount of genetic information to try to, reveal some clues and figure out the puzzle. But 2 is good and 1 is good too.
Okay, and then a couple people were asking, why do only 10 to 15% of families get a result?
That's an excellent question. That is because right now, autism is really complex from a genetic perspective. And when I first started in the field, I thought that, every person, or not every person, a lot of people with autism would have the same gene issue, right? We don't want to use the term genetic mutation because that's sort of like old fashioned and it has a negative connotation. So I'll be saying things like a genetic difference, right? But basically there's an issue with a particular gene. And it turns out that a lot of the genes associated with autism, only like 1 person in 100 may have it, or 1 person in a couple of hundred may have it. So like, for example, P10 is a gene that actually affects brain growth, is also been associated with some cancers, and only a small percent of children on the spectrum have this. So the reason why only 10 to 15% of families are getting a genetic result is just because of the low frequency of these gene issues. If you added up all the genes that are involved in autism, it really accounts for around 15, maybe 20% of all cases of autism. The rest or what's called idiopathic autism, we don't know the causes. But with every passing year, as I showed you, the list of genes keeps growing and growing. And so we're finding more and more. And so in a few years, it's going to be 25%, and then it'll be 30%. Scientists believe that 80% of autism is due to genetics or some genetic thing. But there is around 20% that could be either interact with the environment and genes or purely environmental. And so people are still trying to also understand that 20% that could be purely environmental, like some sort of maternal infection or even pollution, or just things in the environment that are just not very compatible with a person's overall biological profile that causes symptoms of autism.
And then if you could just go over again who the data is shared with.
So the data is, so when you spit into the tube, the tube goes to a company that will process the DNA and it's whole exome sequencing that we're doing. And then the Simons Foundation scientists have the data. And so the data, once they get it, is de-identified. So there's no names associated with it. And then they're doing all of their analyses. And different scientists from around the world might say, hey, Spark, I'd like to get that data. And they can get it, but there's no names. They can never trace it back to any one individual person. It's just a bunch of numbers on a spreadsheet. And so at the initial stage, we have your name when you sign up because we need to match it with the tube of the saliva and the company doing the extraction. But then once it gets to the analysis phase where people are actually looking at it, then it's de-identified. But we have the names so that we can contact you if we find a genetic issue. So, but any data sharing doesn't have any what's called PHI, public health information or personally identifying information.
And then just again, is there an age limit to Spark? And then is there an age limit to the outcome study?
There is no age limit to Spark. You can be any age. Actually, we would love it if there are some older individuals because the mean age of participants is the child is around 8. But we have some individuals with autism on the spectrum over age 50, but not that many. So we love any age. And there is an age limit for the outcome study. I should have mentioned that. We're really focusing on children between the ages of 6 and 11. So we can see how they're doing in school because we have a lot of information. Our center really specializes in the early identification of autism. And we've worked with thousands of children between the ages of 12 and 48 months. And now we're trying to track some of those children when they get into school age between the ages of 6 and 11. So anyone older than 11 is not eligible. And unfortunately, we have a really long waiting list for that study already, which is why I only kind of had 2 slides. So is not a huge number of openings on that particular study, but the Spark study is limitless. We've got, yeah, we can go over 50,000, no problem.
Okay, and then I'm just going to do one more for you. Are biological grandparents or siblings able to participate in Spark?
That's a great question. Palani, do you know, I know back in the past, they were talking about siblings.
Yeah, so full biological siblings of an individual with a professional diagnosis of ASD are allowed to participate, but right now grandparents are not. It's only biological parents as of right now. So full siblings, yes. Grandparents, unfortunately, not.
Okay, thank you.
Okay. And then for Shirley, do you have any information on jobs or any other opportunities for adults with autism?
As a start point, I would refer you back to those YouTube videos. We did one on transition and what happens when the person becomes an adult. There's a lot of information in there. Again, my contact information is on every one of those presentations. You're welcome to email me, but I think that would be a good starting point because we do talk about regional center, vocational training, all kinds of resources in those videos. So focus on the ones that are transition planning and what happens when the person becomes an adult. There's a lot of information there.
And then somebody asked, do you have any personal tips on how to get kids to cooperate and listen better at school?
That is such a wide open question, and it's a very individualized thing. And I think similar to what I just mentioned in the insomnia piece, if a child is really struggling at school and the team doesn't seem to understand, you can request what's called a functional behavioral assessment, where that's a professional comes in and observes the student in the classroom to see first, what is the challenge? You know, are they eloping? Are they aggressive? Are they getting up out of their chair? Are they making noises? I don't know. But though these things need to be data driven, they need to be assessed so that we have a clear understanding of why is the child not listening in this case. And then once that's more clearly identified, then the team can come together and come up with strategies to support them to make them have a better outcome.
And then somebody asked, is there a reason why we should take breaks with melatonin?
This is such a common topic that comes up among my psychiatric colleagues. So the neurologist, I think it's Dr. Jindal at Rady's Children's, we did a presentation on sleep, and she stated that if you use melatonin daily, nightly, for 3 months or greater, it can start to suppress your natural production of melatonin. So I will go with her. She's a neurologist. And so either one, use it intermittently, don't use it every night, or if you feel like you have to use it continuously, you do need to take a break after about 3 months and go off of it for a while, because she said there is data that says your natural melatonin production can be suppressed with the constant supplementation of it. That being said, you have to pick your poison here. If the person's up all night not sleeping and melatonin works, yin and yang. I think it's also an individualized decision here. Mm-hmm. But that's the academic answer.
All right, and then a couple people asked, is there any way I can have my child tested for autism? Someone said that their child was 3 years old. So I guess this may be for Dr.
Absolutely, there's many places in town. It's not just regional center that you can go and get an ASD evaluation. So contact me at my work email and I can connect you with a lot of resources in the community where people with 3-year-olds can go to be assessed for autism.
And our center
and Dr. Pearson's lab, right?
Yes. The cool thing about our center is everything's completely free because we're all funded from the National Institute of Mental Health, Simons Foundation, Centers for Disease Control. And so we have lots of different studies, although again, most of our studies for the free evaluation part really only goes up to age 48 months. So if your child is not 4 yet, then you can participate in we have a genetic study that is separate from the Simons Foundation, where it actually relates to looking more closely at different things in blood samples. So your child will participate by providing a blood sample, and then we do a full diagnostic workup, which includes from a licensed clinical psychologist, the ADOS, which is the Autism Diagnostic Observation Schedule. We'll do a test called the Mullen Scales of Early Learning to assess your child's expressive and receptive language abilities. We'll also ask you some questions using a tool called the Vineland, which gives adaptive functioning level estimates based on your responses. And then we give you this written report when we're done. And then also at the end of your appointment, we'll make a 4-hour appointment time block, although it's usually done in around 3 hours. You will have a free one-on-one consultation with the psychologist who did your child's evaluation, and he or she will tell you on the spot, your child's doing great here, but these are the areas of weakness. And if they are meeting criteria for autism, we will refer you for services that same day to regional center. So yeah, so it just really depends on what kind of funding we have. We don't provide evaluations to kids over age 4 for free, but you can like participate in Spark, for example, at any age up to 50, 60, 70, 80 years old, but that there's no evaluation associated with that particular study.
And then just a couple of ones that just kind of went in right now. If the parent has participated in Spark by sending in a sample and they find something in their genes, will they be given the data or only if it affects the child?
That's a really excellent question. And Palani, will have to, Spark, the Simons Foundation that supports this project, is constantly kind of evolving in their kind of stance on these sorts of things. Like, for example, I know at one point they were considering providing feedback to both parents and child. Let's say you had a BRCA1, which is a gene for breast cancer, or an APOE gene, which relates to Alzheimer's, right? There are all these new genetic findings that have nothing to do with autism, but they could be found in your saliva sample. And I know the Simons Foundation was considering returning those results, and it's possible the parents could have something that they find, but not even the child. So that's an excellent question. And we will contact the Simons Foundation and see what their most up-to-date stance is on that. And then we'll email everybody. Or Kalani, if you know who this particular person is, we can email this person directly.
Right. And then somebody just asked regarding the sibling question, can the sibling participate only if they have a diagnosis of autism? And that's no. So if it's a full biological sibling, they can just register regularly. They don't need to have a diagnosis.
Yeah. Oh, yeah. If you had one child on the spectrum and 5 typical kids, I think all the typical kids can participate. And my office is apparently a big mess. I guess because you can't, my slides are no longer up. You can see my messy office. So I apologize for that.
We have somebody asking, what is the best way to get a professional diagnosis for an adult?
Okay. Again, that's in the slide about transition planning and so on. Why don't you contact me directly through my contact information? Like, we get asked that a lot. It's not as easy as it is when the kids are under 18, but it is not an impossible quest. But there are some specific recommendations I can make for you, but I would need some kind of more personal details about your medical insurance and things like that to support you in that area. So if you can reach out to me and contact me directly, I can hopefully get you pointed in the right direction for that.
Great. And then somebody asked, does it make sense or is it worth it to reevaluate my child? They were evaluated at the age of 2 and he is now 10.
That's an interesting question. Go ahead.
It is. What is the reason that you want, you think he was incorrectly diagnosed at 2? Or, again, I think the question would be, we don't do assessments just for the sake of assessments unless we're thinking maybe something else is wrong, maybe something was missed, was it inaccurate? So I think there's no harm in having somebody reassessed, but I think about why you want to have that done, perhaps.
Exactly. I think that sometimes families really see a lot of wonderful improvement in their child, and they'd like to see if their child lost their diagnosis. And that's perfectly, I think, reasonable reason to go ahead and do that. So you can kind of measure change from when they originally got diagnosed to kind of how they're doing now. Are they still meeting criteria? Sometimes, that can have, implications for IEP planning or what's going on with the child in other aspects of their life. So if you're just feeling like my child's doing so well, and, you have a place that you can go to for this additional evaluation, it's not, it's an emotional reason to do it, but there's also practical reasons too.
100%, yes.
For surely. Somebody asked, you mentioned refraining from naps may help, but isn't a lack of sleep linked to triggering seizures possibly?
Yes, it is. but also sleep dysregulation is as well. So again, I think that's something you talk to the neurologist about if individuals having seizures or has a seizure disorder, but sleep deprivation, absolutely, or sleep dysregulation can be a trigger for seizures. So medically, it's super important that they have regulated sleep. Napping, it sabotages nighttime sleep.
Yeah, I totally agree. And I just want to say on a personal note, I use a weighted blanket myself. I think they're amazing. And I know a lot of children that do. And, they're a little bit expensive, but it really can be helpful. I know that Shirley put that on her list. And I'm just saying, I'm a big fan of weighted blankets. I love mine. Like to the point where sometimes when I travel, I want to take it with me, but it's so heavy in my luggage. Like, love my weighted blanket.
Yeah, for those of you that are familiar with Temple Grandin, she's a woman in her later 60s now with autism spectrum disorder. She had created as a kid a squeeze machine, kind of that pressure on the body, which is what a weighted blanket I think provides a comforting, calming sensory experience. So yeah, I mean, there's lots of non-medicine ways to see if we can help an individual sleep better, including non-autistic people.
Yeah.
Okay, and then just a few more. Somebody asked Dr. Pierce, we have signed up a couple of years ago. I'm not sure. Oh, for the outcome study. And they're saying, is there a link we can use to follow up on the outcome in the future?
Well, the outcome study's only been going on for a couple of months. So maybe what they mean is they signed up for some other study, like one of our early detection studies or whatever. I think I'm understanding the question correctly. We are trying to improve our ability to disseminate information on our website. So families who signed up for studies a couple of years ago, they can go on our website and see kind of what the results are of some of the things that they've been participating in. So that's one way to do it. You can also feel free to contact me or Palani or someone at the Autism Center of Excellence. Say, hey, we participated in one of your studies a few years ago. Just wanted to see, what study, how things went with our participation in terms of, any research findings. And we're more than happy to look up and see what your child participated in. So those are kind of two ways, but we do try to disseminate everything to the public through publications. It just takes a long time. We're very meticulous about the analysis and the rigor and the writing. But yeah, our website, we have published well over 100 papers on autism in high impact journals.
And then somebody asked, for a 60-pound kid, how many pound blanket would you recommend? Or Shirley, maybe.
That's an occupational therapy question. I would add, so if your child's in school, I'd ask an OT to do a conversion. There is a conversion, you don't want to put a 40-pound blanket on a 60-pound kid. No. So there is a conversion. So if you have access to occupational therapy, either through private channels or at school, I would reach out to your OT and ask about that. I mean, you can Google it. There is information about what's an appropriate weighted blanket for XYZ kilos or pounds. So that's another option. But if you want a professional opinion, I would go the occupational therapy route.
Yeah, it's usually a percentage of your body weight, like 10% of your body weight. Don't quote me, but that's, I think they usually sometimes do it just based on a percentage.
And then I guess a lot of people are kind of asking, like, how do we sign up for this? How do we sign up for that? How do we contact Ms. Fett? So, we'll definitely send out follow-up emails. And some people had to leave and they're asking, will this be recorded? And we'll be sending it to them.
Yes. Yeah, we can. Yeah. I mean, I think probably a better thing, since it's probably a large file, is Palani, we can post it on our Autism Center of Excellence website. And then Shirley could potentially post it on her website as well, so people can go ahead and view it, because sending out this huge file to everybody might be a lot. But I think we can send links to it locally on our particular websites. So, well, I think we've had a great discussion. So I think this is a great place to wrap up. And thank you so much, everybody, for attending and being so enthusiastic. We love it. And I look forward to hosting another webinar with Shirley one day in the future. And thank you so much.
Bye. Thank you, guys.
Thanks, everybody. I appreciate it. Thanks for the invitation to speak as well. Bye-bye.
Yeah, thank you. Bye. Bye.